Hey everyone, thanks so much for the introduction, Haley. I guess we can just move on to the next slide since we already got introduced. Our study focused on pharmacy staff in all kinds of different settings. We were curious because pharmacy is considered a very accessible healthcare profession. And so we wanted to see what the current perceptions, knowledge, and patient education practices of pharmacy staff were related to summertime health topics. This was everything from wildfire smoke, extreme heat, among other things like vector-borne disease. And we also wanted to look into if there were any barriers that people could identify related to their abilities to educate patients surrounding these topics. And as climate change alters the frequency, severity, and timing of these health hazards, it's likely that pharmacists and other pharmacy staff members are going to be asked about these kinds of things more frequently, so we felt that it was very relevant. So the results of our study, we utilized a survey kind of snowball sampling way to collect our information. We sent it out. We had responses from various states, particularly the Northwestern kind of Rocky Mountain region, but we did have responses from all over the United States. And it was interesting because there were different reported areas of knowledge, many ranked into the moderate or kind of very knowledgeable, while many kind of fell off into the far extremes. And it was interesting because a lot of pharmacy staff felt like there were certain topics that were very, very important for them to be educating patients about, like medications and photosensitivity, the impact of medications on heat-related illness, and medication storage during hot weather. So there were things that people felt were very passionate. They think that patients need this information. But then when we asked about how often respondents were actually counseling patients on this information, you can see that a huge amount of the results ended up in that far end, which is actually the never category, or the less than one encounter per week category. So people think it's important, but they're not talking to patients about it. And then we wanted to look into why is this happening?
So, as we looked into these survey results and saw that discrepancy between perceptions of importance and the actual implementation of patient counseling, we wanted to identify barriers to that patient counseling. So, one of the ones that we focused on, because we wanted to find a barrier that was modifiable for our pharmacy staff members, we found that they felt they didn't have an adequate background or comfort level with the information for climate change and disease states and its effects on medications in order to provide that counseling. So, the next phase of this research looks into this specific barrier, and we are compiling information to provide to these pharmacy staff members that are both provider information materials as well as patient education materials that they can give to their patients as well. We are also pursuing the use of pharmacy students in order to have a direct and active education opportunity. Through this, we will use P4, which is the fourth year pharmacy students that are on clinical rotations. We will provide them materials and information in order to train them to be experts on the information that we are providing, and then they will provide presentations to their site specifically, and then continue to follow up on the staff members at those sites in order to see if providing that information in an in-person format is more beneficial and proves to have better outcomes than a pharmacy staff member just downloading that information themselves. Our goal is to overcome this barrier of a lack of education for pharmacy staff as well as other healthcare professionals and work towards building a foundation for pharmacists across the state to provide essential education for their patients, act as advocates for the climate, and discover their role in protecting our communities from these health hazards. So we have provided a QR code if you would like to receive those provider and patient education handouts once we have compiled and completed them, for you to receive that information yourself. And we would love to have any questions that you have.
Just another example of the mentoring process goes both ways. So you are mentoring the mentors is what you're doing. That's lovely.
Thank you very much. Yes, it's an important concept, and I've seen it throughout my clinical rotations this year. I finish up in a couple of weeks, but every time I get to a new site, my preceptor's like, tell me about some new drug that you learned in pharmacy school that I didn't get to learn about when I was in pharmacy school, because we typically learn about the newest drugs in the moment. So we could also be learning about some of the other newest developments in other areas, not just drug-specific things. Thank you very much.
Thanks for your interest in Montana Health Professionals for a Healthy Climate's annual conference. If you'd like to be kept up to date on monthly actions for climate and health in Montana, you can go to montanahphc.org/newsletters to sign up for our monthly newsletter or click the link in the description below. And don't forget to subscribe.